1063.com.
And now, it's Coast Vue with Ricky Matthews. Brought to you by J. Allen Toyota and AGJ Systems and Networks on SuperTalk 103.1 FM.
Welcome to Coast Vue, the show that celebrates every single day the people who are making coastal Mississippi a better place to live, work, and play. Hey, listen, I'm not going to share any motivational points or motivational quotes or any of that. With cases of Delta continuing to climb, I wanted to jump right to our good friend, Dr. Nicholas Conger, an infectious disease internist at Memorial, and get the latest. We had him on about a week or so ago. But, you know, he anticipated that the cases would continue to climb, and they have. And I just think it's important for us to kind of sort through all the politics and all this national noise and see what's happening locally. I think, Nick, the thing that I continue to focus on is that people are going to make their own decisions, but we need to make sure they've got the best decision and matrix in front of them. In other words, the best information that they can get their hands on. So I look forward always to visiting with you, especially during this pandemic. So what's the latest there, buddy?
Well, hey, thanks for having me back. I really appreciate it. And yeah, that's kind of been my approach. Is I'm trying to share with your listeners, what I believe to be true. And things do change, and we get more information, and there's some things that I'm sure I've said that haven't held up over time. But we try to give the best information so that people can make those decisions. So right now, we're seeing a pretty darn big surge. It's kind of, I guess it's the fourth wave. Not unexpected. We saw this in other countries. Even countries with high vaccination rates have had high waves. But the different vaccination rates have played a role in the mortality, and we can talk about that later. But yeah, it's kind of packing the hospital. We're getting 5 to 10 admissions a day, which we haven't seen in a while. And goodness, I hope it peaks here soon, sometime soon, and we start to see the other side of it soon.
Yeah, I wish that we were talking more. One of the things, so we're in the fourth wave now, but up until this point, I thought that most public officials did a pretty good job of talking about what's going on in the hospitals. And I don't know if you've seen Lee Bond, the CEO of Singing River Health System, but he's been doing a sort of regular newsletter every few days. So he talks about the number of people who are admitted, the number of people who are in ICU, the number of people who are on ventilators. And he really focuses on the number of people who are in the hospital who have been vaccinated versus those who have not been vaccinated. And they're running in the 99, sometimes it's 100% of the people who are there are those who are unvaccinated. But still today, you think that the biggest defense we've got is the vaccination. You still feel that way, don't you?
Yeah, that's right. So for the previous strain, we talked about how the vaccines, the Moderna and the Pfizer in particular, had like 90% to 95% protection. Now it's lower with this Delta strain. However, remember the secondary effect was to not make you sick enough to be hospitalized. And then the third level of the tertiary effect was to not let you die from it. And so I think that we need to be very precise in our language. There are some vaccine failures. And what I mean is they never made an immune response to the vaccine. And we're seeing that in people who are immune compromised, particularly solid organ transplant patients on multiple immune suppressant drugs, to where the vaccine doesn't even work for them. Those are rare. But these other cases, I wouldn't call them failures. I call them breakthrough infections. And what we see are mild infections. And when they get hospitalized, they don't need oxygen a lot of the time. Most of them that are vaccinated that get hospitalized, they say, oh, I feel terrible, but they don't need oxygen, and they're home in a couple of days. So that's a vaccine breakthrough, mild breakthrough infection, but it's a success because there are people who otherwise would be dying. And so some people have expressed frustration to me, like, I got vaccinated, I got lied to, I still caught it. Hey, it's like, hey, buddy, you're able to yell at me that you're frustrated. That's good, because if you didn't have the vaccine, you'd probably be so short-winded you wouldn't even be able to raise your voice. So that's a point I want to make, that if you get a very mild case after vaccination, then that's a success. And also the vaccinated people, they don't transmit it near much to the rate as unvaccinated people. So yes, that is the key to getting through this. And I've said it time and again, everyone's either going to catch COVID and live or die with it, or they're going to get vaccinated. And this Delta strain is so much more contagious, it makes the idea that everyone's going to catch it happen a lot faster.
Yeah, you've talked about this all along. When you get vaccinated, there was never a guarantee that you wouldn't get COVID. They never said that. They said always that you're going to be protected. You may not get COVID, but if you get COVID, if there is a breakthrough case with you after you get vaccinated, that you have a very high chance of avoiding serious illness, hospitalization, and death.
Yeah,
And
right.
that's still the case today.
Absolutely. And so, like, when you hear about these like athletes, like these Olympic athletes, they're getting tested, right? And you hear about these poor athletes that get a positive test and they can't compete and they have no symptoms. Well, what that is that that's probably someone where the vaccine worked, right? They got exposed. It's in their nasopharynx. They're not sick at all. I feel bad for them because they may not even be contagious. We don't know. But it's like that shows you there's a lot of people out there getting exposed to the virus that have zero symptoms. And so for many people, it does prevent infection. But if it doesn't prevent infection, it does significantly decrease your rate of hospitalization and death. And we are definitely seeing that.
Nick, one of the things that you and I have talked about before, and I think we should just kind of focus on it here again. When you look at the people who you're dealing with currently in the ICU, when the critical care nurses and doctors are focused on the people who are in the worst condition today, almost always they are the unvaccinated, correct?
That's right. That's right.
And when you look at the ones who are dying with a very small, in the case where someone died who may have gotten a vaccine, there was some autoimmune issue, something was there that caused this to be an exception to the rule. But for the most part, this is not, what you see are cases that involve where there is death involved or significant ICU time. It's not vaccination, right?
That's exactly right. And, that was backed up in what happened in Great Britain. They're a few weeks ahead of us, and they had this wave, and there were more cases than they thought they would have because that's a country that's 80% plus vaccinated. However, if you look at the death rate from the previous wave, I think it was something like 33 per million, like 33 people per million died during that wave, which you always have a denominator. During this wave, even though there are a lot of cases, the death rate in England was something like 2 per million. So that's a reduction from 33 down to 2. That's a 90% reduction in mortality with them being 80% vaccinated. So that shows you that the vaccine does significantly impact mortality. And yes, with rare exception, the people on the ventilators for weeks and weeks that have died or may eventually die, some of them might make it, they're unvaccinated.
So let's talk about this for a second. The CDC has multiple roles. They're gathering lots of data. This data is really important. They're getting data in the United States, data from around the world. They're also involved in messaging. Their messaging can change from time to time. My read on the situation is that the CDC, I want to get your thoughts about this. From a messaging point of view, they've blown it at some points along the way. The data is important, and you trust the data for sure. But what that's allowed, though, is for people to have a lack of trust in what the CDC is saying. That's enabled them to become politicized, which unfortunately I hate when COVID is politicized. We should not. This should be the one thing that politics shouldn't be involved. But I'm not dumb about that. I understand how it works. What's your current thinking about the CDC?
Yeah, I think that, the CDC has been a little bit slow to react, I think, and they tend to come out with these all or none, everybody needs to do this. Okay, nobody needs to do this. Okay, now everybody needs to do this. And I think that the message hasn't been precise from them. And I think if they shared the data and the thought process, and we're a big country, we have cities and rural areas, we have states with vastly different population densities and different rates of COVID. And so one size does not fit all. And I think that there's some nuance to this argument. And I think if they shared the nuance in their thought process a little bit more and trusted the American people to listen to the data, then I think that more people would do the right things, kind of willingly, because there's this trust there. So I do think that there's a little bit of a break in trust. I know that the people there probably have good intentions. I know some people that work there, and I know they have good intentions. But I think they've lost the control of the message. And part of that's with social media, too. Things can take off good and bad on social media. And so it's hard to stay ahead of the message. But I think a little bit more sharing the data with the American people and continuing to build that back and forth trust would have been helpful to the institution.
So, Nick, I spent a lot of time. This is Dr. Conger, infectious disease doctor from Memorial, really good friend. I spend a lot of time on social media just trying to get the right information to people. And buddy, you won't believe, I said this the last show, and this continues, the amount of videos and misinformation. Like, for example, one of the things that was being shared is that more people recently have been killed by the vaccine than by COVID. I mean, it just, people, first of all, that's not true, right?
Right. Yeah. I'm big, advocate for free speech, and in America you do have a right to be wrong, and you do have a right to share things that other people don't agree with, but yeah, I mean that, when you hear things like that, that's not true. We are having a pandemic and people are dying, and I kind of wish we could have people kind of tour through the hospitals and see it, that don't believe it, because when it happens sometimes to your loved ones, it's too late. And we see a lot of regret at the bedside. We talked about those sick patients in the ICU. We see a lot of regret. I should have done this. I should have listened. I thought this was a hoax, and here I am dying from it. So we do hear it. So it is a real pandemic.
I know that's tough.
Yeah.
Hey, listen, let's do this. We're coming to the end of this segment. We'll come back on the other side. I want to share a couple more pieces of misinformation and just get the right thing. Then I want to talk about kids for a second. Kids in classroom. Some classrooms are already in place, and there's already some issues that are popping up, and we'll have that conversation as well. We'll see you after this break.
Coast View on SuperTalk 103.1 is brought to you by J. Allen Toyota on I-10 exit 38 Gulfport. See all the incredible inventory at allentoyota.com. And remember, when you think Toyota, think J. Allen Toyota.
Hey, South Mississippi, it's Jay Allen at Jay Allen Toyota, and I got something new for you for 2021. It's the Jay Allen Certified Collection. What that means is we selected our very best inventory with under 75,000 miles, and they're 6 years old or newer. That comes with a multi-point inspection, a 10-year, 100,000-mile warranty, and a 3-day buyback guarantee. So come check out the Jay Allen Certified Pre-Owned Collection right here, I-10 exit 38 in Gulfport, or on allentoyota.com.
If Alexa's part of your life, you've got one more way to access SuperTalk. SuperTalk Mississippi is now available on Amazon Alexa devices. Once enabled, just say, Alexa, play SuperTalk Mississippi at any time and start listening. It's that easy. Just one more way to stay informed and connected with your state. Learn more at supertalk.fm/Alexa. SuperTalk Mississippi. SuperTalk Mississippi. Now available on Amazon Alexa devices. Feeling down? Here's your prescription for a daily dose of good news and positive vibes. Good Things with Rebecca Turner. Every afternoon, Rebecca highlights all the good things happening right here in the state you call home. Daily exposure to Good Things with Rebecca Turner may cause smiling, feelings of positivity, happiness, and even laughter. When you experience these symptoms, tell your friends to listen. Okay. Weekdays starting at 2 p.m. here on SuperTalk Mississippi, and now on Amazon Alexa devices.
When COVID started, Gulf Coast Business Furniture and Supply began stocking hard-to-find PPE items. When Amazon and other mega internet companies were out of stock or inflating prices, Gulf Coast Business Furniture and Supply was providing local schools and businesses vital PPE supplies at fair prices. When your office needs PPE supplies, office furniture, or products to keep your business operating, consider Gulf Coast Business Furniture and Supply. We sell that too. Buy local.
SuperTalk Mississippi.
From outer space, visitors from another world. We've had contact with bug-eyed monsters.
This is actually a flying saucer.
Flying saucer?
I'm from another planet.
Where late nights are kind of weird.
Well, they must have a reason for their visit.
The unexplained, the weird, and the downright creepy. Coast to Coast AM with George Norrie. Late nights. SuperTalk Mississippi.
106.3 Casino Radio is here. Tune to 106.3 to discover all of our must-see attractions and everything that's happening at our 12 incredible casino resorts. Where to eat, where to stay, what to do, and where to play. 106.3 Casino Radio has you covered with everything you need to know to help make your visit here to the coast one you'll never forget. Turn on 106.3 Casino Radio or listen now on our website, CasinoRadio1063.com.
Talking to the people that help make the coast such a unique place to live. This is Coast View with Ricky Matthews on SuperTalk Mississippi Gulf Coast 103.1.
Welcome back to Coast View. We have Dr. Nicholas Conger with us. He's an infectious disease doctor, internist at Memorial Hospital, a really good friend to Coast View. And of course, we're focused on the Delta variant cases in Mississippi and here along the coast continue to skyrocket. And unfortunately, people are having to face serious illness, hospitalization, and in some cases death because they chose not to get the vaccination. You know, as Dr. Conger continues to point out, the best defense we have currently is the vaccination. You know, one of the things, again, I spend a lot of time on social media just trying to help people get the right information. Some people I've just given up on. Some people who are my friends, I'm hanging in there with them. Hopefully, you're creating some kind of sideline conversation that I can convince them that their point of view is dangerous. What's amazing to me, unfortunately, Nick, is that too many people, okay, they've made their decision based on what information is in front of them, but what they do then is they spend an inordinate amount of time on social media trying to convince their friends and family that they shouldn't get vaccinated, that this is all about, like what somebody posted this. Is there a test for the Delta variant? No! Exclamation point. Then how would we know you even have it? I'm like, what difference does that make? But Nick, what do you think when you see that?
Well, you know, specifically that question, you know, we do send all the tests to the state, and then they run the Delta variant on a percentage of them to see, you know, what percentage of them are. So there is a test for that, but we don't specifically do a test up front for that. But I think the larger point there is that, I mean, that's a human condition. You know, if you make a decision that in your heart, you know, might be a little controversial, it's just human nature to want to have other people on your side.
Yeah,
playing out.
So I want to tell you, this is a very specific case. This is something that got posted just in the last day or so, but this is from Jamie Campfield Bates. She's actually the nurse manager at Bienville Orthopedics, so she's been a nurse for many years. And she has a student, or a son actually, that attends elementary school. And so they've had 1 week of elementary school, 7 positive kids at the school. And they go into, if someone's been within 3 feet of that person, they'll quarantine them. But what they don't recognize is that when they go from classroom to classroom, they're close together. When they're eating together in the cafeteria, they're eating close together. It's almost impossible, really, to try to do any contact tracing just because of the way that it's going. And so you're seeing just a number of parents get pretty worked up about the situation. But it is interesting that with the original, before Delta came along, the schools were doing one thing, and it seems like they've become a little more lax in the guise of Delta, which is more contagious. So what you're thinking about kids today and classrooms and face masks and just, what's your current thinking?
Well, I'm going to punt a little bit and say, we're still trying to figure it out. I think last school year went off pretty well. I can't remember a kid, even at Memorial, that was admitted for COVID. We maybe had 1 or 2. We've had some admitted that we found that they had COVID, but it by and large, it was just a mild illness, if not an illness that skips children. Now, the Delta variant does seem to change things. And so I think we have to have a wait and see approach. I share, parents' concerns. If the infection goes through the pediatric community and they're a little bit sick and then they all do fine, well, then they're all going to get natural immunity and they'll be immune. Because natural immunity, I do want to make the point, I believe natural immunity is just as good, if not better, than vaccination. Not that I want people to get vaccinated. I don't want them to live or die with COVID. But with the pediatric population, I think we need to wait and see, I don't know if it's going to be more deadly in that population. I don't, and then the vaccine only goes down to age 12. So I don't have a lot of answers for you on that. Like I told you that, I kind of make my opinions on the data as it comes in, and I am seeing more kids with COVID for sure. And I think that people should know that, that it's definitely a possibility out there. So, have
you seen severe cases with children?
Again, not as severe here. That doesn't mean it won't happen. What we're seeing is more requests for the monoclonal antibody for children, particularly though, again, those that are immune compromised or have maybe severe asthma or are significantly overweight, same risk factors for adults. So we're definitely now, and in fact, we're meeting today to try to come up with a program to deliver the monoclonal antibody to children because, I'm an adult infectious disease doctor. And the emergency authorization initially went down to age 18. And so, yes, we're getting some requests for that. Not
So
seeing the hospital
actually,
deaths, though.
talk more about that specifically. We've talked about that in the past, but this is one treatment that has really shown some good results, as opposed to all these like potential wonder drugs that everybody says is the key to success. The antibody that you just mentioned has had tremendous success. Talk a little bit more about that.
Yeah, I think it's a fantastic treatment. We've kept data on it. We have some nurse practitioners that have been running that program, doing a fantastic job logging in everybody, and we can compare it to historical controls, and we see a significant reduction in admissions and a reduction in death. It's not foolproof. We do see admissions and we do see some deaths, but much less than compared to historical controls. Now, the problem with it is the earlier the better, and the outbreak now is so spread, so rampant in especially the unvaccinated, that we were doing 5 a week when there was that lull. We're doing like 250 a week. We are almost running out of the product. We have to constantly beg for more. We're opening up alternate sites, and again, it's a good drug, but it's emergency use authorized, just like the vaccine. So again, if your plan is, I'm going to see if I catch COVID, and if I get it, I'm going after the monoclonal antibody, man, you may have to wait a few days, because we're trying to get people in as fast as we can. Some people are waiting 3 or 4 days, and you need to give it within the first 10 days or it doesn't work. And it works even better if it's given earlier. So we're seeing a backlog. So why not get the vaccine that's emergency use authorized and prevent the infection if you can, or have a mild infection, then catch it, and then try to get monoclonal antibody, which is also emergency use authorized.
Nick, you mentioned the monoclonal antibody and the fact that you are giving so much more of it today. It's interesting. And you also mentioned the nurse practitioners and them doing the scheduling, whatever. I had a friend of mine is a nurse practitioner. She was over at the house a week ago. It was not long after you and I had talked last time. And I was sitting with her, and I'm not exaggerating when I say this. Her phone message was lighting up about every minute during the conversation. And every time it lit up, it was someone needing to schedule the antibody.
Yeah.
It was unbelievable. I said, tell me, explain what you're doing. Tell me what's that all about? She says, Ricky, it's unbelievable. And I'm scheduling them as I get them, because if I don't do that, they'll just start stacking up. And so this is on a Sunday. I'm just having to do it as they come. But I just got the sense that she was really overwhelmed. I mean, all these professionals are overwhelmed, aren't they?
Yeah, the American medical system, I think, is the best in the world, and I'll defend it, to anybody. But there's not a lot of built-in surge capacity, meaning there's not a lot of people sitting around with nothing to do. Because if you are, then you really don't have a job, right? And so if you think about it, we have all the business in the hospital, we have all the outpatient clinics doing their thing, and then you add 200 to 300 people a week who need an infusion that takes an hour. They have to be consented for it, and then they have to be observed for an hour. Where are you going to do that? You have to we have nurses that are doing extra shifts, volunteering. Now, and by the way, when they volunteer, they're exposed to people with COVID, like the most contagious people. And then we have nurse practitioners who have their own day job that are adding the scheduling to it, that are going over there, that are running over there from different clinics, from different inpatient services. So we are creating that out of just people working overtime, basically. And kudos to them for stepping up.
Part of the irony is this. Some people state that they don't want to get the vaccine because it's emergency use. It hasn't been officially approved by the FDA, so they don't get the vaccine, but they end up with Delta, and then they're begging for the next drug, which is also emergency use, not approved by the FDA yet, in order to limit their condition. When in fact, if they'd have gotten the vaccine, would have been their best defense going in. I mean, you deal with this every day, multiple times a day, don't you?
Yes, absolutely. And, it's like, there's a new surge when getting texts, 10:30 at night, every night, Friday night, Saturday night, Sunday night, then it's like, what, there's another surge of COVID, so, it does take its toll on the healthcare workers for sure.
We were going to have a critical care physician join us today, but as you can imagine, those guys are busy. I mean, working full time in the ICU has to be an incredibly tough job these days.
Yeah, it certainly is. And, when when they have a high success rate of saving people, it's super rewarding. But when there's a high probability of mortality once you're on the ventilator, which is often the case with COVID, it can be tough. It can weigh on you. It's kind of like, I was in the Air Force and I did one short tour in Iraq and seeing, the death of war. It's jarring, and it's almost like that. It's almost like we have this incredible surge, like a mass casualty of people with an infection. It has the same effect. It does take its toll on people. So, keep the healthcare workers in your prayers for sure.
Well, God bless you, my friend, and all those who you work with on a daily basis, and the work you do to save people of coastal Mississippi. And just simply, there's a really important message that comes from this conversation. That is, get the vaccine. Just get the vaccine. That's the best way to avoid hospitalization, serious illness, and potentially death. And most people who are in the hospital who are not vaccinated wish they had got vaccinated. That's one of the most important messages that came out of this. Hey, we're going to stay in touch, Dr. Conger. We appreciate your time, man.
Yeah, thanks for having me again.
Hang in there. When we come back, we're going to have the VP of Digital for SuperTalk Mississippi Media, James Wynne. We'll see you after this break.
106.3 Casino Radio is here. Tune to 106.3 to discover all of our must-see attractions and everything that's happening at our 12 incredible casino resorts. Where to eat, where to stay, what to do, and where to play. 106.3 Casino Radio has you covered with everything you need to know to help make your visit here to the coast one you'll never forget. Turn on 106.3 Casino Radio or listen now on our website, CasinoRadio1063.com.
When COVID started, Gulf Coast Business Furniture and Supply began stocking very hard-to-find PPE items to make our community a safer place. When Amazon and other mega internet companies were out of stock or inflating prices, Gulf Coast Business Furniture and Supply was providing local schools and businesses vital PPE supplies at fair prices. They were even sending thousands of dollars of PPE supplies free to local schools in need with help from other local business leaders. The next time your office needs PPE supplies, office furniture, or products to keep your business operating, consider a local company that supports your ball teams, cheerleaders, and area homeless. Consider Gulf Coast Business Furniture and Supply, the local guys that keep your prices fair, your service and selection excellent, and your health our business. Gulf Coast Business Furniture and Supply. We sell that too. Buy local.
SuperTalk.fm has a new look and is more informative than ever with expanded Mississippi news coverage, the latest Mississippi weather, Mississippi sports, and of course, the talk that's important to you. Every show, every podcast, and every late-breaking story. Constantly updating the news the second new developments happen. All in one place. The new SuperTalk.fm.
SuperTalk Mississippi.
From outer space, visitors from another world. We've had contact with bug-eyed monsters.
This is actually a flying saucer.
Flying saucer?
I'm from another planet.
Where late nights are kind of weird.
Well, they must have a reason for their visit.
The unexplained, the weird, and the downright creepy. Coast to Coast AM with George Norrie. Late nights. SuperTalk Mississippi.
Hey, South Mississippi, the future has arrived. It's 2021, and at J. Allen Toyota, we're here to serve you. Want to let you know that we have Allen's lifetime warranty on every new Toyota we sell. That also comes with Toyota Care. That's 2 years and 25,000 miles of complimentary maintenance. We have a great rental department. Our service department's ready to take care of your current vehicle. We're rolling out J. Allen certified pre-owned for 2021. You got to come to I-10 exit 38 right here in Gulfport. You're going to love what we have to offer. When you think Toyota, think Allen Toyota.
Feeling down? Here's your prescription for a daily dose of good news and positive vibes. Good Things with Rebecca Turner. Every afternoon, Rebecca highlights all the good things happening right here in the state you call home. Daily exposure to Good Things with Rebecca Turner may cause smiling, feelings of positivity, happiness, and even laughter. When you experience these symptoms, tell your friends to listen.
Okay.
Weekdays starting at 2 p.m. here on SuperTalk Mississippi and now on Amazon Alexa devices.
Hey, I'm Steve Azar, and you never know who or what you'll hear when I spend a Mississippi Minute with my friends. Talking to Paul Thorne, Mississippi true treasure, really incredible recording artist, singer, songwriter, has been doing it a long time, doing it the right way.
It's almost like a Forrest Gump thing because, I was a boxer, / I worked in a furniture factory, / I had a gig 2 nights a week playing my acoustic guitar in a pizza restaurant, / I was in the National Guard. And,
wow.
All this stuff was going on at the same time. / I had a writing contract with Rick Hall and Fame.
In a Mississippi Minute. Be sure to check out In a Mississippi Minute with me, Steve Azar, right here on SuperTalk Mississippi, the SuperTalk Mississippi app, and now available on iTunes, Google Play, and Stitcher.
For something new and unique in talk radio, take a listen to The Ben Shapiro Show. Every day, we're driving the debate in America with the fastest moving, hardest hitting, most comprehensive, fact-based commentary on the radio. We don't hold back. We never shy away from telling you the truth. Our show is a meeting place of ideas. We have the most important guests and the biggest thinkers in America.
Weeknights at 9.
For something new and unique in talk radio, take a listen to The Ben Shapiro Show
on SuperTalk Mississippi.
SuperTalk Mississippi. Just seems to me people have so much invested in not telling the truth. When you want the truth. Simply because it might hurt some feelings. And nothing but the truth. Lose some subscribers. You want the Gallo Radio Show. I just think in this audience, you still believe that if you tell the truth, you come out ahead. The Gallo Radio Show. And if you tell yourself otherwise, you're lying to yourself. Mornings on SuperTalk Mississippi.
And now, it's Coast View with Ricky Matthews. Brought to you by J. Allen Toyota and AGJ Systems and Networks on Super Talk 103.1 FM.
Welcome back to Coast View. I really enjoyed that conversation with Dr. Nicholas Conger, the infectious disease doctor at Memorial. What the professionals in healthcare are having to deal with today is startling with the surge of Delta cases. And as Dr. Conger points out, and every professional that I talk to points out, the best defense we have is the vaccine. Get vaccinated. What they're having to face is heartbreaking, really heartbreaking. And they're going beyond the call of duty to protect coastal Mississippians and keep us healthy. And we really appreciate that. So anyway, let's shift gears now and move over to James Wynne, the VP of Digital for SuperTalk Mississippi Media. James, how are you doing, buddy?
How are you doing, sir?
I'm doing fantastic. I love your accent, incidentally. Where are you from?
Actually, I'm a true Londoner of London, England, but I do tell people on the coast that I grew up in a little Amish community in Perkinston, Mississippi. And we all love watching our James Bond movies. So
yeah, cool. So how long have you been in the States?
England is where I was born and raised.
Yeah, how long have you lived here?
30 plus years now,
wow.
Stateside in the Americas.
Well, there you go. I love your accent. Hey, listen, one of the things that I love about SuperTalk Mississippi Media is that, I first of all, I had this opportunity to do Coast View. I'd been retired for 4.5 years. They convinced me to come in off retirement. And, I come into the studio in my house. I do Coast View. They've got Kyle and Cammie and a group of people to support me, so I don't have to worry about the day-to-day of putting this show together. I just come on the show and have great conversations with people. I'm not involved in the day-to-day operation, you know that. But I can't help but make observations because I came from newspapers and digital media companies, and later in my career I was involved in some significant digital media efforts for Advanced Condé Nast. And I learned a lot about what this transformation is all about. I have been incredibly pleased to see SuperTalk Mississippi Media not only continue to strengthen their radio stronghold, we'll talk a little bit about that in a second, but they're building this incredible digital capability. And as the VP of Digital for SuperTalk Mississippi Media, you've got to be pleased with what you see in the ownership and the leadership of this company now that you're part of that leadership team, to build a company that can hit on all cylinders. It brings incredible radio capacity and also brings incredible digital capacity all to the table with the clients. That's a cool place to be, isn't it?
Very, very blessed. Steve Davenport, the owner of SuperTalk and its offerings, has made a sizable investment into the digital platform, and the ability to go to market for advertisers with a full arsenal behind you gives us a unique advantage over our competitors in our especially in our radio world. We're having the corners of Mississippi and taking the full reign of national with our digital capabilities. We get to bring it all into a local setting for advertisers here on the coast and regionally. We're blessed with the investment he's put forth for the company.
Yeah, what Steve Davenport and Kim Dillon, the president of the company, and their team has done has been really remarkable. I've talked about it many times on the show, but they've resisted the urge to sort of sell out to the big guys. What's happened in the iHearts of the world and others have moved to more of a sort of a global, more of a national scale. But what I've learned about radio is that the key to success is local weather, local news, local personalities. And, you know, if you think about it, Steve owns 26 radio stations, but then he has a number of other networks, the Ag Network, news networks, and others that go into other stations that amass about 51 stations across the state. As part of the SuperTalk network specifically, there are 12 stations that are, as you pointed out, in every corner of the state, including here in coastal Mississippi and all the inner areas. I mean, it's a critical strategy for success to have very local radio stations that are incredibly successful, I might add. We'll explain that in a second, combined with best-in-class digital capabilities. And it really makes for a winning strategy, doesn't it, James?
Absolutely. Influencers like yourself, Ricky, when you're looking at the radio side of the business and the popularity of influencers across the social media platforms, when you have a CPR that has local talents that are reachable to the community and are in the community, gives them we have a strong advantage against those national type brands. You're at events, and we're able to put on mass appeal events like the big food truck festivals and the CPR fests and the Gulfport music fests, and it's driven by your local talent. When listeners engage with their local talent, they have somebody they're connecting to, and having that local imprint for advertisers and being able to bring that and deliver that true local element of news and entertainment, it's a winning combination for both the media side and its listening audience.
So what's interesting about the coast, for SuperTalk Mississippi Gulf Coast, which is the station 103.1 that we're on now, it's building capacity, more listeners. Obviously, it's got a big social media presence, and Coast Vue has sort of been helping with that. But then you got, as you mentioned, CPR and the Monkey and others. When you bring all these sort of these brands together, this radio brand, this sort of powerhouse, how much of coastal Mississippi do you reach? I'm just curious.
Oh, 1 out of every 3 people you're touching on a daily basis. That's powerful.
Wow. It is very powerful. Tell me about the stations real quick.
Oh, CPR, legendary radio station created by the now market manager, Kenny Vest. And you've had Kenny Vest on your show, and he's a very humble fella. But what a brain, what a mind, and his influences across the nation on music formats and how he created CPR as an alternative rock station that just delivers huge ratings each and every year. That's the powerhouse of the market. But then you have the SuperTalk and yourselves, and look at unbelievable growth ratings just on Coast Vue. We appreciate everything that you're doing to bring in that community, to bring in additional listeners to our platforms, which has been great. And then you have the soccer mom station, G96.7, with the superstars like Tic Tac, who's nationally known, local to us in Gulfport. What a blessing it is to have him and Patty Steele, the legend of this market for many, many. She's been in the market for 30 plus years, I believe, also. Patty, don't hit me, but I think it's about 30 years. So she probably started radio when she was 3 years old. And then you have the Monkey. My goodness, how strong of a station has that been over the years? And even as it changed, moved to 105.9, continued to keep that listening audience. And now it's on a super growth pattern for the CHR formats. And Lucas and also Patty's also on that station also drives that brand for the Monkey. That's pretty dominant brand on the coastal Mississippi. And then you have Casino Radio. So if you're looking for what's going on in town as far as, what restaurants to go to, facilities and casinos and how to gamble, there's an opportunity there for listening audiences. When you combine that power and that reach of radio, the branding, the possibilities when it comes to the biggest voice on the coast, it's nice to be partnered with this company and in its growth pattern. And that's the changes of some media companies. They're downsizing while SuperTalk Mississippi is on such a huge growth pattern currently.
It's amazing to watch. You think about when I came here, I didn't know about how does regular radio, in the industry we call it terrestrial radio, but how does regular radio sort of stack up against satellite radio? And as you pointed out, everything that I read, the reason why local radio continues to perform well is because of that local connection. People really want that local connection, as we pointed out just a second ago. But when you add it all together, it creates this sort of dynamic solution for advertisers. I wanted to know, for example, what's the benefits of radio versus, say, newspaper, or what's the benefits of radio versus like TV, for example? And what I learned is that certainly immediacy. You can decide you want to do a radio commercial today and probably get it today. Certainly you can get it tomorrow. So for sales and events, it's a great way to do it. In a company like SuperTalk Mississippi Media, you get to go across multiple brands, and so you can push all of these stations toward an event. That's one of the reasons why event marketing is so powerful for this company. The cost of production is not as high, and then it's an affordable approach. Then you combine that with digital capabilities, and it's a winning proposition. When we come back, we're going to talk a little bit more about what's happening with the digital capabilities in this company. We'll see you after this break.
You can also listen live to SuperTalk Mississippi Gulf Coast 103.1 on your Amazon Alexa devices. Once you've enabled the skill, just say, Alexa, open SuperTalk Mississippi Gulf Coast.
SuperTalk.fm has a new look and is more informative than ever with expanded Mississippi news coverage, the latest Mississippi weather, Mississippi sports, and of course, the talk that's important to you. Every show, every podcast, and every late-breaking story. Constantly updating the news the second new developments happen. All in one place. The new SuperTalk.fm.
Hey, South Mississippi, it's Jay Allen at Jay Allen Toyota, and I got something new for you for 2021. It's the Jay Allen Certified Collection. What that means is we selected our very best inventory with under 75,000 miles, and they're 6 years old or newer. That comes with a multi-point inspection, a 10-year, 100,000-mile warranty, and a 3-day buyback guarantee. So come check out the Jay Allen Certified Pre-Owned Collection right here, I-10 exit 38 in Gulfport, or on allentoyota.com.
When COVID started, Gulf Coast Business Furniture and Supply began stocking hard-to-find PPE items. When Amazon and other mega internet companies were out of stock or inflating prices, Gulf Coast Business Furniture and Supply was providing local schools and businesses vital PPE supplies at fair prices. When your office needs PPE supplies, office furniture, or products to keep your business operating, consider Gulf Coast Business Furniture and Supply. We sell that too. Buy local.
SuperTalk Mississippi, your new home for the Ben Shapiro Show.
We don't hold back. We never shy away from telling you the truth.
The most electrifying national talk show on air today.
We have the most important guests and the biggest thinkers in America.
Ben Shapiro, brutally breaking down the issues of the day.
From politics to pop culture, we take a look at all of it. So don't miss out.
Weeknights at 9.
For something new and unique in talk radio, take a listen to The Ben Shapiro Show.
On SuperTalk Mississippi.
SuperTalk Mississippi.
Just seems to me people have so much invested in not telling the truth.
When you want the truth.
Simply because it might hurt some feelings.
And nothing but the truth.
Lose some subscribers.
You want the Gallo Radio Show.
I just think in this audience, you still believe that if you tell the truth, you come out ahead.
The Gallo Radio Show.
And if you tell yourself otherwise, you're lying to yourself.
Mornings on SuperTalk Mississippi.
Hey, I'm Steve Azar, and you never know who or what you'll hear when I spend a Mississippi Minute with my friends. We're talking to Del Berra. Take me back to growing up and what it was like in the household with a dad like Yogi Berra.
You know, we grew up with his funny sayings. You know, I remember Dad managing the Mets, and me, Larry, and Timmy are watching the game on TV. And all of a sudden, two streakers run out of the stands on TV, and the camera flips away from them. So when he gets home, me, Larry, and Timmy say, "Hey, Dad, those streakers, what were they, boys or girls? We need to know." And Dad looked us right in the eye and said, "I couldn't tell. They had bags over their heads."
In a Mississippi Minute. Be sure to check out In a Mississippi Minute with me, Steve Azar, right here on SuperTalk Mississippi, the SuperTalk Mississippi app, and now available on iTunes, Google Play, and Stitcher.
Talking to the people that help make the coast such a unique place to live. This is Coast View with Ricky Matthews on SuperTalk Mississippi Gulf Coast 103.1.
Welcome back to Coast View. One of the cool things about doing this show is I get to continue to learn about this company and get to learn, who are the people who drive this company. As I mentioned, I'm not involved in the day-to-day. I'm just not. If someone goes and sells a sponsorship for Coast View, I don't really know that's even happening. I'm not involved in any way. But I'm thrilled when there are sponsors. I'm thrilled about that. But I'm not asked to be involved in it. I'm not involved in those day-to-day decisions, and I'm thrilled about it. But as a former CEO of a digital media company, I can't help but make observations about the success of this company, and I have shared my observations from time to time with Steve Davenport and Kim Dillon, and they've always been very interested in, what did I learn in my previous life and how can they learn from that? So I think that's a cool thing. But we're having a conversation now with James Wynne. He's the VP of Digital for SuperTalk Mississippi Media statewide. He's actually located here in coastal Mississippi. But he's involved statewide, so he's got tremendous responsibilities. One of the things I know, because I came from this world, James, is that there's so many different people who do digital. Newspaper companies, radio companies, TV, even ad agencies are involved in digital. In our case, we've built significant digital capabilities. When combined with radio, it creates a force to be reckoned with. But the key is internal skill sets, people like yourself who really get this stuff and who our customers can trust to guide them through the process. At the end of the day, it's the relationship building. Once you build the capacity, it's the relationship building that makes the difference. And I hear you're really good at that.
I tell you, it's not just James. I am blessed, honestly blessed, to have a diverse and experienced digital team behind me. Because when you have that, when you've built that capacity and you have your designers, you have your television production teams behind you, mass amounts of experience and having that superior technology that goes to market for its advertisers to be able to research and have project managers on teams to go over campaigns and to look at the data. And for us, again, that capacity with SuperTalk, it's that first person data that's important, where we get to take a look at that information from campaigns that we've deployed look at and have a educated talk to our clients about directions that they need to go with their advertising. It's very important to have that team behind you. So thank you for saying James is great, but I promise you this, it's the vast amount of team knowledge that we have behind me that makes my job day to day very, very easy.
So James, of course, for the average person, they wouldn't understand if you and I started getting into the difference between first-party data and second and third-party data and all this stuff. So we're not going at that level. But what I really want to know is, just for the average person who's listening, when we talk about a digital platform, what are some of the product lines that are within that digital platform?
Oh, it's like, just think of it as your house. Your foundation to your house is your websites and your SEO campaigns, the SEM campaigns, your search on the Google, having a strong foundation in search for an advertiser. And then you look into what opens doors for most advertisers. Is it the social media side? Are you using the platforms such as the Pinterests, the Facebooks, the Snapchats, and TikTok, all that exciting technology? And I tell you, my niece says, I know what you're doing. I see the ads. I know what you're doing. They're all over my Snapchats. And what you're trying to do is bridge that information that the customers to get to their advertisers and have that great conversation one-on-one. Digital allows you to be really personable when it comes to advertising. I can take that message and create it specifically for your experience. And it brings back for an advertiser a tremendous amount of return on their investment when they can put the dollars in strategic buckets and in the digital platform, as you said. And if you're looking into an OTT with the digital television advertising over the top, and there's the social media giants out there that we get to capture the data and share that with advertisers. There's a lot of digital.
Here's the way I would describe it, and often did in my prior world, and that is that the average advertiser can't learn these skill sets. I mean, it's just, not only are there multiple platforms to have to learn about, but then things are constantly changing. New technologies are arising, things are constantly happening. And what is cool about what SuperTalk Mississippi Media has done in bringing you into this role as VP of Digital for the company is they've solidified what is going to be a growth opportunity for this company, and they've created this incredible, diverse slate of products that can solve advertiser needs in ways that are very unique. And listen, we're going to continue to have conversation with you because I think it's interesting. It's sort of at the core of the business model for our company, but more importantly, it's just an interesting conversation with someone who knows what they're talking about. So I appreciate you spending a little bit of time with me this morning.
Anytime, Ricky. Anytime.
This has been the VP of Digital for SuperTalk Mississippi Media, James Wynne. And I've enjoyed, visiting with you, James. Your wonderful accent, of course. Have a great day, and we'll see you tomorrow.
Ricky, thank you so much. It truly was an honor.
You bet.
Thank you, sir.
Follow SuperTalk Mississippi Gulf Coast 103.1 on Facebook. Facebook.com/SuperTalk MS Coast 103.1.
Hey, South Mississippi, it's Jay